This is my 5 minute quiz. First, we get a history. We try to get a history from those around us. Basically, the mechanism of the incident history. We check for previous medical history, current medications, and if they have allergies or not. And then on our way to the athlete, we put on gloves. We check for environmental factors, uh, weather, field hazards, and equipment. We check for the body position to see if their heads are to see if they have a spinal cord injury. We check for bleeding, deformities, and their skin color. And then when we're at the athlete, we look for consciousness. If they're knocked out, we call the 911 immediately. We move on to primary assessment. We do not remove the helmet for this. We check for signs of life. We listen to their breathing, their pulse, and the breathing for around 10 seconds. And then we obviously have to get the AED. And for compressions, if I was one person, it's 30 compressions per two breath. So basically 100 to 120 per minute. And then if two people, it's 30 compressions per two breaths as well. And then when the AED analyzes rhythm, we call 911. CPR, during the CPR, doing that, we call 911. And then if they have life-threatening bleeding, we check for severe bleeding, and they control their pressure points and their bleeding output with touching the pressure points to breaking up for more arteries. And then if they have spinal injuries, if their arms up, we stabilize their neck and head. And if they're conscious, with assistance, we put on a cervical collar, and then we could even log roll them and then spine board them if the EMS are there. And then we look for symptoms of shock. First, there's pale skin colors, cool clammy skin, weakened fast pulse, and really fast breath, dilation of pupils, blood pressure falling. And then if they're pale blue, that means they have a hemorrhage. If they're pale red, that means they're heat stroke. And then we take their vitals, we take their LOC, and we take their pulse, blood pressure, respiration rate, and their skin temperature and appearance. And then lastly we check their pupils responsive to light by using the Pearl test. Secondary amendment head to toe. We ask them for history first. Where does it hurt? Do you have pain in your neck? What happened? Can you feel any numbness or sensations? Can you move your feet? Wiggle your toes? Can you move your hands? Wiggle your fingers? And then what happened? And then orientation, we check for level of consciousness. We ask who, what, when, and what were you doing? And then we do the head to toe survey. We check for obviously signs of severe injuries, bleeding, fractures, deformities, edema. And then we first start with the head, scalp, eyes, ears, nose, mouth, and then blood for cerebral spinal fluid. Then we check their cervical spine, and then we have them remove the collar to find point tenderness, dislocations, and then move on to the chest and the lumbar spine. We check for point tenderness, dislocations, abnormalities, and then we check for trunk, clavicle, shoulders, chest. We have to see if their movements on both sides are equal, normal rise and fall, chest rib compression test. We check for crepitus or false abnormal movement. For abdomen, we check the four quadrants and rigidity to see if the muscles are rigid or not. And then for the right upper quadrant, liver, we check for liver, gallbladder, colon, right kidney, left upper quadrant, stomach, spleen, pancreas, colon, and left kidney. We check for Kerr sign. Right lower quadrant, colon, intestines, appendix, and the ureter. We check for McBurney's point. For women, we check left lower quadrant. We check ovaries, colon, ureter, and the ovaries, and the fallopian tube, and the left lower quadrant. We check for bladder and uterus. And then we move on to the pelvis. We do the compression test. Fractures, if they're outward rotation of the hip. If it's longer, it's a fracture. And if it's shorter and it's rotated inwards with a knee flexion, that's a dislocation. We check for the legs and feet. We check for fractures or bleeding. Then we check dorsal pedal and tibial pulse. And then we check their motor response by plantar dorsiflexy feet. And if they're unconscious, we check for Babinski's response by scratching their foot. And then we have to check the sensations. And if they're unconscious, we scratch each arch of their foot. And for arms and hands, we check for fractures, bleeding. We check for pulse. We check motor response. And to do that, we have to squeeze our fingers and check their feeling sensations. We have to scratch the insides of their hands. And then last, we have to recheck the vitals. We have to recheck the level of consciousness, the pulse, respiration, blood pressure, skin temperature, and then again we have to do the Pearl test with our eyes. This concludes the primary and secondary survey. Now I have a better understanding of the specific injury. I will maintain the airway, continue to perform rescue breathing, CPR until relieved by qualified medical personnel. I will control bleeding, splint fractures, treat for shock, check vital signs for every 5 minutes, and monitor the level of consciousness constantly. I will then refer my patient to a physician as needed. Right on time.